Oh, this is our patient Ed, who we just had the fortunate opportunity to review his treatment, and it looks excellent. So tell me a little bit about your challenges that we had at the start.
Oh, at the beginning, it was quite a tragedy as far as I'm concerned. We had a surgery that was, to put it mildly, was botched, and Dr. Duello came to my rescue and corrected all of the improper implant positions, and we did restoration of the bone, the gums, and did some grafting, and things turned out wonderfully. Couldn't have asked for a better outcome.
So you're able now to chew on a side where you weren't able to chew for a while.
For quite a while. I'm like a new person.
So chewing is improved. Your bite feels better, I'm sure, because you got teeth on both sides.
All of the oral requirements are there. Expectations. It's just normal as could be.
And I believe you commented that you can floss now comfortably. It's almost like you have your natural teeth back.
Right.
Okay. And what message would you give to doctors who are watching this video about technology and clinical treatment? What would you give us as help?
I would say probably the best thing is to align yourself with somebody who is considered to be an expert and is indeed an expert in this field before you ever attempt to do any of this type of surgery. Dr. Duello Point is the one who I would recommend, and someone of his stature, someone of his skill level, because if you, I'll exaggerate a little. If you take one of these junkets down to the Bahamas and go through a weekend seminar and you walk away with a degree or a piece of paper that says you're trained in a certain technique, believe me, it's not as easy as that. There's a lot of training that goes into this, technique development, skill level, and technology. So the physiology, the psychology of the patient, and the doctor is important, and all of these things are interplayed. And it's something that doesn't come instinctively. It comes with training and instinct. It's not any one or the other, it's both. So
we co-discovered together your treatment, your solutions. We used some advanced technology from Noble Biocare. Explain a little bit how you felt about that, using guided surgery and computers to manipulate images so we knew what we had as a patient.
As a patient, you couldn't ask for anything better, because the visualization of what was there, the subsurface structure, and then what was going to be placed there was absolutely clear. I mean, it left nothing to the imagination, and the outcome, after looking at the final x-rays, confirms that everything worked out exactly as planned.
And I believe we worked in an interdisciplinary team approach. I worked with Dr. Matthes, a prosthodontist, and he felt very confident once he saw you that everything would go well, and my assumption it did.
Exactly. Yeah, and the outcome, at least from the visual aspect, is perfect. It looks great. The teeth are all aligned beautifully. And from the practical aspect, the use of the teeth, it's just absolutely wonderful. I mean, it's as natural as could be.
Well, we appreciate you sharing this information with us, and we hope this information is helpful to patients and to professionals who are either in the process of getting training or doing implant dentistry. And you were very instrumental in helping me appreciate my staff and the time that we take to help our patients. And I'm glad you had a good outcome, and I'm really happy that you've been restored, you're back to function and smiling again and no pain. So thank you very much.
You're very welcome.